My questions to the Minister of Health and Long-Term Care. Speaker, just when we thought it couldn't get any worse for home care patients in Ontario, the Auditor General tabled her report last week that revealed additional concerns about the severely troubled CCACs. What the opposition suspected, and we now know that the ministry has done little to address multiple issues that were identified 5 years ago. 5 years later, some Ontarians are receiving less care because of where they live. 5 years later, supports still aren't available to the friends and families caring for home care clients. In fact, over 12 years, there's been no thorough evaluation of the current CCAC delivery model that ensured CCACs were providing consistent and quality care. Mr. Speaker, where was the accountability, and why, over the past 12 years, did this government set up CCACs to fail?
Well, thank you, Mr. Speaker. I appreciate the question again. And, Mr. Speaker, we acknowledge that there is much more work to be done. I've accepted all of the recommendations of the Auditor General in her September report. We're working on implementing those. We're working on implementing her recommendations that came out most recently in her annual report. And importantly, Mr. Speaker, this work began earlier this year in earnest when we received Gail Donner's report on home and community care that pointed the way, and we accepted each one of her recommendations, turning them into an action plan, focusing on the quality of care and the timeliness of providing that care. And I think even the member opposite would agree that what we need to do is we need to continue that transition because innovations allow us to do so. The support that we're able to provide allows us to do so. Provide as much of that care as we can in the community and in the home environment. That's what we're working to do, and we know that there's much more work to be done, Mr. Speaker.
Thank you. Supplementary.
Mr. Speaker, back to the Minister. Speaker, the Auditor General's report revealed that the number of patients served by CCACs has only increased 20%, while spending on home care services has almost doubled. This government knows that whenever possible, the ideal place to provide care to seniors is in their own home, care that prevents expensive hospital visits, that maintains their quality of life. Speaker, this government has known for quite some time that our senior population will only continue to grow. Mr. Speaker, the CCACs investigated in this report never allocated the maximum number of home care hours it could because of budget constraints. Mr. Speaker, why have the Liberals allowed CCAC bureaucracy to eat up 40% of home care funding year after year?
Thank you again, Mr. Speaker. And the member opposite is a healthcare professional, and he knows that in recent years the patients that he's seen or would see now, they're coming to him with increased complexity of care. That's what we're seeing in our home care environment as well, Mr. Speaker. And so our ability, fortunately, to address those individuals' needs and their family and caregivers' needs in their home and in their community, our ability to do that has increased, but it also requires those important investments to take advantage of innovations and deliver that quality of care. That's why we continue year after year to the point where almost $5 billion, 10% of the health care budget is invested in home and community care. That's going up by $250 million this year, $250 million next year, and the year after that. And we're making those changes as pointed for us by the Auditor General, by Gail Donner's report. We're continuing to make those changes to advance the quality of care, Mr. Speaker.
The question, member from Oshawa.